Check, check, check. 1, 2. All right, if we can do a quick audio check for anybody who needs it. One, two, check 1, 2. Check the audio. 1, 2, 1, 2, 1, 2. Hey, hey, hey. 1, 2. Does it sound muffled? Yeah? Sounds like I'm wearing a mask. All right, everybody good? Okay, we'll probably get some more later.
Everybody ready?
Wardrobe change. I can talk better with this one on. All right, let me say good afternoon. And today I'm here with Chief Acevedo, Chief Pena, Dr. Purse. And so let me just say good afternoon to everyone on this Monday. I want to begin today by acknowledging the death of one of our Houston firefighters, Jerry Pacheco, who was assigned to Station 101 in Kingwood. Firefighter Pacheco died this morning from COVID-19 of complications. On behalf of the city of Houston, I want to extend my prayers and condolences to his family and fire department colleagues. Pacheco is the second Houston firefighter to die of the coronavirus. The funeral for Captain Leroy Lucio was held last week, and I'm sure that Chief Pena will have more to say. We have also lost 6 of Houston municipal employees in the last several weeks because of COVID-19. And I was also informed this morning, Chief Acevedo, that the wife of a Houston police officer has died from the virus, and I believe she also lived in the Kingwood area. The tragic deaths are a reminder that community spread is still a concern in the city of Houston. July for Houston, July was a tough month for us. Our positive cases and the number of deaths double compared to the 4 previous months, March through June. So we lost more people tested positive in July than the 4 previous months. Today, the Houston Health Department is reporting 1,104 new cases of COVID-19. That's 1,104, bringing Houston's total now to 50,896. Sadly, there are 6 newly reported deaths, bringing the city's total to 478. The demographics of the 6 people who died are on the monitor next to the stage, and you will note that the youngest person was a Hispanic man between the ages of 30 to 39 years of age with no underlying health conditions. All 6 who passed away that are being reported today are Hispanic, and I want to express my condolences to each and every one of their families, their relatives, their friends, those who they work with. It is imperative that we bring the number of people who are testing positive and dying down as much as possible in the month of August. I want to applaud the Houston Health Department for launching its Better Together, Todos Juntos Mejor campaign to target communities with high positivity cases. They are literally going door to door in many neighborhoods to educate people with their community outreach campaign. While they're out there, they are wearing masks. They're also practicing social distancing when they go out in the community. Over the last several months, our focus has been on educating and encouraging people to mask up, social distance, and wash their hands. So in March, April, May, and June, the message has been put your mask on, mask up, engage in social distancing, and exercise proper hygiene. So the focus has been on education. And yes, there are some positive signs from those efforts. Hospitalizations in the city of Houston have declined. That's a good thing. But they still remain high. The positivity rate has dropped. Last year, we were talking about the positivity rate being around 23%. The positivity rate as of today is 17%, so it too is dropping. But we need that positivity rate to be 5% or below. That's the goal. 17 is too high, 10 is too high. The number needs to be 5% or below. And because we cannot repeat in August the numbers that we had in July, today I'm announcing that we will begin issuing citations to people who are not wearing their masks under the state's mandatory mask order. When we started this process, it was about educating. We have been doing a lot of that. But now, when our police officers and firefighters and others are encountering people who are not wearing their masks, we are going to be issuing the necessary warning. Please put on your mask. And a failure to do so will cause a citation or ticket to be given. We are not going to be responding to 911 calls when people are calling in saying so-and-so didn't respond to, don't have their mask on. HPD will not be doing that. But when we are encountering people on patrols, out and about, and we are seeing that they do not have their masks on when they're in public and around other people, we will provide the necessary warning, and then a failure to heed to that warning will lead to a citation and a $250 fine. So please, please, I'm asking you, people in our city. When you're in public, you're around other persons, please put on your mask or you run the risk of receiving a citation. We know that wearing a mask or face covering in public is one of the most effective methods to slow the spread of COVID-19. For months, we have been focusing on education and not citations, but now I'm instructing the Houston Police Department to issue the necessary warnings and citations to anyone not wearing a mask in public if they do not meet the criteria for an exemptions. So please, don't get mad at the police officers. It's all about public health and driving our number down, especially when school people in-person schooling is scheduled to start in September. Fall is right around the corner with flu season. August then becomes a very, very critical month. Lives are at stake, and so I'm taking this step to do our very best to drive these numbers down. And I'm asking for your cooperation in helping us to do that. And again, as we have seen the hospital admissions go down, that's a good sign. We're seeing the positivity rate starting to drop, that's a good sign. But being at 17% is a long way from being at 5% or below. And if you notice, I think this is the 5th day in which I'm reporting positivity cases of at least 1,000. That is still way too high when you consider, for example, in April and in May, we were talking about 125, 150, certainly no more than 200 cases. So we need to drive those numbers down, and I'm asking people to cooperate and work with us in order to get that done. Now let me pause and call up let me call up Dr. Pearce.
Thank you, Mayor. Last month, the mayor proclaimed August was going to be Better Together month here in Houston. And in doing so, he has brought us all together to do better and challenged us to do better. He emphasized, and he just did again, a need for us to get the positivity rate down to below 5%. Last week, when I reported the positivity rate had gone from its high of 25.9%, last week we were at 23.3%, which was not a very big drop. This week, it is down to 17.6%. So that's a considerable drop. So I think it proves that when we work together, we can do better. So Mayor's right, with our Better Together slogan, it can become reality. And we need to keep moving in that direction, because while we have moved, and this graph shows, the purple line is the 14-day average. So that is we calculate that to make sure that it doesn't have a lot of variability from day to day. That is a very solid number. And you can see that the purple line does dip down to the 17. You'll see that the bars are dropping down as well. That's a little bit misleading, because that has to do with the volume of tests. So that has nothing to do with the positivity rate. That is the volume of tests. So what that indicates is something we also talked about last week, and that is there is lots of testing which is still available. People are not going and getting tested as much, which has me concerned, but to focus on the positive, I want people to know that if you want to get tested, and you call our number at the health department, there is plenty of testing capacity and capability available. So if you were worried about there being long lines, that's not quite so much an issue anymore. We have plenty of ways to get you tested, and we will do that because, unfortunately, not everybody is taking advantage of it. So let's go ahead and take advantage of it. Now is the time. We're moving in the right direction. Let us not lose momentum. On our next slide, we're going to look a little bit more graphically. We looked at the neighborhoods. We've shown slides like this before. And again, I want to caution everyone that the darker the blue, those are the neighborhoods where we're seeing the higher percent positive. Remember, the dark blue here indicates a zip code where the testing positive rate is greater than 30%. So that is very, very high. But also note that those that are more lightly colored, they can still be up to as much as 20% positive. So that does not mean that there's no activity there. That's one thing about using the colors here that can be a little bit misleading. There is virus spreading in each and every zip code in Houston. And this reflects the residence of the people where they live. This doesn't reflect where they became infected. And we update this every week, and this helps us with the health department as we drive our efforts into neighborhoods to try and get folks the help that they need, whether it be awareness or an opportunity to be tested or whatever other resources. And as the mayor pointed out, we are now going and knocking door to door in neighborhoods to make sure people get the information they need. And the next thing I want to point out is when we get tests that come back that are positive, Those are considered to be cases, and we will then start off with case investigation. So we reach out to the folks who have tested positive. And if you should get a phone call where the caller ID is Houston Health and or the number is 713-853-8700, that's the health department reaching out to talk to you to make sure that you have everything you need to know if you've tested positive. That also starts the process of contact tracing. So that's the phone number. You may get an email, because when you signed up, if you gave us your email address, you may get an email from Houston Health Department at qualtricssurvey.com. That's going to be our way of reaching out to you, because that's how you indicated you wanted to be reached out to. Or perhaps you'll get a text message from one of three numbers, 35134, 73940, or 39242. Again, which is our way of reaching out to you to get that case investigation started. Now, here's the thing that's really important. If we as a community are going to get ahead of this virus, and we are currently behind it with a positivity rate of 17.6%, we are still behind it. If we're going to get ahead of it, that means we need to contact the cases, talk to them, and then find out who their contacts are so we can tell them that they need to protect themselves and their loved ones as well. That's how we get ahead of it. So please, when we reach out to you, take our phone call, take the email survey, text back with us, work with us. We will never, ever, the health department will never, ever ask for anything like your social security number, your immigration status, your bank account number, none of that stuff. If anybody starts asking you those sorts of things, that's not us. Hang up, click off, do whatever. That is not us. We will never, ever ask for that. We have no reason to need that information. So we will never ask for that. We will ask you about where you've been, who you've been with, and help us help you. And remember again, the people that you're most likely to infect, number one person you're most likely to infect is a family member. The number two person you're most likely to infect is a coworker. And after that comes friends and neighbors. So we're looking out to protect the people that you care about the most. That's your family and your coworkers. So help us help you protect your neighborhood and your family and those that matter most to you. And then finally, one thing I want to say, and I know that Chief Pena is going to probably talk about this too, but if you start developing symptoms, know, I'm switching hats from my health department hat to my EMS hat, know that if you're developing symptoms and you're feeling ill, that's the time to start reaching out. Whether you've got a primary care doctor, if you've got a home health, or a health home rather, a medical home, reach out. We want to help you. Please don't wait until you're so sick that you're in real big trouble. It makes it more difficult for folks to treat you and to get you back on your feet. So once you start getting sick, go to a clinic, call your doctor. If you need to call and go to a hospital emergency department, so be it. Remember, 911 is for emergencies only, but don't wait until you're so sick that you're in really big trouble. And I know that I believe Chief Pena is going to probably talk on that too, but those are my comments today, Mayor.
Chief Pena.
Thank you, Mayor. Good afternoon, everyone. So, as the Mayor mentioned earlier, it's with heavy heart that I report that we have lost a second Houston firefighter due to complications of coronavirus in as many weeks. And I want to offer my deepest and most sincere condolences to the Pacheco family. I did speak with his son, who's also a Houston firefighter, Justin, this morning. Actually, I talked to him. We texted back and forth yesterday, and his dad, firefighter Jerry Pacheco, was still doing well yesterday afternoon. And this morning, sadly, we got the news that he had expired. He took a turn for the worse and he expired. So please keep the Pacheco family in your thoughts and your prayers. Justin, Jesse, and Janeth, we're thinking of you and we're lifting you up in prayers. And please ask the community to do the same. In regards to quarantine for the Houston Fire Department, we're at 130 today. We have 31 firefighters that are positive for coronavirus at this moment. None are in the hospital. In the total operation, we've had 218 firefighters that have tested positive. 187 of those have since come back and returned to work. So, you know, this thing is hitting the Houston Fire Department really hard. And I'm sure my colleague, my friend Art, will share the same about the Houston Police Department. We're asking the community to please help us do your part to ensure that we're stemming the increase of this virus. the best recommendations that we have right now, and we've been hammering them every time that we come up here. 3 simple things: wearing your masks, proper hygiene, and the proper physical distance are going to go a long way to ensure that we are stemming the increase of this virus, and it's going to help us create some capacity and try to get ahead of this sooner than later. We have, in regards to our occupancy task force, in the last 24 hours, we had 86 complaints that we responded to. We had 2 referrals, 2 businesses that were referred to TABC for lack of compliance and lack of movement towards compliance as well. So again, look, the Houston Fire Department is going out. We are a resource. Our inspectors and our investigators are a resource for these businesses to help them come into compliance. The vast majority, we've had over 9,000 complaints since we began these orders, and the vast majority of them have been resolved correctly and voluntarily, and we appreciate that. Those that don't, they are going to be referred to the TABC. The TABC has taken quicker administrative actions. And again, it's about creating a safe environment for your patrons and these businesses. The mayor and Dr. Peirce mentioned the calling 911. If you've seen it in the news, we've reported the fact that we are seeing a heightened number of people that are expiring at home. Okay? They call 911 for an emergency, and by the time that we get there, there is nothing that we can do. People are just waiting way too long to call 911. If you're having symptoms of the coronavirus, shortness of breath, chest pain, any other true emergency, call 911 immediately. We've heard anecdotal comments about people being afraid to be at the emergency room because they think that's where the virus is. That is not based in fact at all. And you're much safer at the emergency room than you are at your home if you're having a true emergency. If you're having slight symptoms of fever, aches, call your primary care physician. Call them early. Again, it's important for you to be evaluated early so you can have a better chance of surviving this and making it out. When you call 911, again, to the entire community, the entire city of Houston, I want to mention the fact that any information that we obtain is strictly for patient care and to communicate that appropriately to the receiving hospital. We do not share this information with any other agency other than the insurance and the hospital where we deliver our patients. So do not be afraid about immigration status or any other item that may keep you from calling 911. Our focus is to ensure your safety, treat you appropriately, and deliver you to the hospital where you can get definitive care and do it early. That's my report. Thank you, Mayor.
Chief Acevedo, HPD.
Thank you, Mayor. First and foremost, I want to extend my condolences to the Pacheco family and to all of the men and women of the Houston Fire Department. We've been praying for the Pacheco family since we found out that he was sick, and now that he's passed. And also to, I'm not going to release the name because I don't have that ask from our officer, but his family, and to all of those impacted by COVID-19. I mean, this is our second firefighter. We've lost 2 members of our department that were support team members. We have extended family that we've now lost, and Mayor, so I join you in saying that it's time for people to do the right thing. Just wear a mask. We've got a lot of things going on in our city and our country, and the last thing we need is to continue to get each other sick simply because we want to exercise our right in our minds. And what we need is for people to stop worrying about selfish interest and think about the collective interest. We are better together, and we don't want to write tickets. What we want people to do is do the right thing, to follow the science and simply have the courtesy to wear a mask in public and follow the other health and safety guidelines that have been put out. Just to put this in context, Mayor, we've had in our department now, as of today, we have 172 members of the Houston Police Department that are in quarantine. Out of that 172, 108 have already come back positive for COVID, and 64 are awaiting their results. And this happened very rapidly. We had been doing very well until right after Memorial Day when we started opening the state, and we only had like, I think, mid-40s. Well, now we've had 439 members of our department, 439 members of our department that have come back positive. And it's impacting disproportionately the African-American community and the Latino community, and it's really important. I want to, for a minute here, just talk to the Latino community, the immigrant community, the Spanish-speaking community. Es muy importante que la comunidad hispana sepa que este virus, COVID-19, es un virus muy peligroso. Hemos perdido otro bombero, 2 bomberos ahorita, miembros de mi departamento, y es importante que la comunidad hispana sepa que el impacto ha sido muy grande a los latinos y a los hispanos en este país con este virus. Es importante que se pongan las máscaras, que presten atención, que mantengan la distancia social de 6 pies y, más importante que nada, póngase la máscara, lávese las manos y vamos a proteger a nuestra familia, a nuestros colegas, a nuestros vecinos y a nuestros oficiales y bomberos que están en peligro todos los días. En el departamento de la policía hemos tenido más de 400 oficiales que han cogido el virus y muchos de ellos ha sido por los contactos públicos. Si se siente enfermo, es importante que vaya y llame a la clínica médica o vaya al médico. No espere que esté tan enfermo que ya cuando vaya ya es muy tarde. El doctor Barón, que el alcalde Turner conoce muy bien, es un gran colega, un gran médico aquí en Houston. Yo he hablado, platicado con él muchas veces. Muchos hispanos están esperando hasta el último minuto ir al doctor y es muy tarde. Por favor, hagan caso a las autoridades de la salud pública y, más importante, si está enfermo, vaya al doctor. Okay, that's my report, Mayor. Thank you.
And also from the Health Department, I think we have Mr. Valeriel, who can talk about the community outreach and things that have been done in the, from the Health Department, especially as it relates to the Hispanic Latinx community.
La amenaza del COVID-19 que enfrenta Houston y particularmente la comunidad hispana es más grande que nunca. Los hispanos es el grupo étnico más afectado a este momento. El Departamento de Salud de Houston está reportando que el 46% de las muertes que estamos viendo son en la comunidad hispana. Por ejemplo, hoy, como anunció el alcalde Turner, todas las muertes fueron en personas hispanas. Es muy importante recalcar que las campañas que está haciendo el Departamento de Salud, así como la ciudad de Houston, son de gran importancia ahora. Por ejemplo, estamos pasando el material educativo, las visitas casa por casa en diferentes vecindarios más afectados. También estamos haciendo los anuncios y pancartas y también presentaciones a negocio. Al momento tenemos pues una transmisión en la comunidad que no está controlada. Por eso es importante recalcar que hay que ponerse la máscara, también distanciamiento social, lavarse las manos muy a menudo y también si la persona siente cualquier síntoma o se da cuenta que estuvo con una persona que tiene el virus, que salió positiva, es importante hacerse la prueba. Al momento hay hubo mucha demanda en semanas pasadas, pero al momento hay bastante lugar para que la persona que no se ha decidido a hacerse la prueba lo haga ahora.
Thank you so very much. Let me also say that, as Dr. Person indicated, getting tested is important. And we have seen in the last week so the numbers going down in terms of the number of people getting tested. Again, let me encourage everyone, please go and get tested. That's very important in protecting yourself and your family members. The Houston Health Department and its agency have 18 testing sites across the city for the week of August the 3rd. I also want to mention that on August the 8th, a testing site will be open next to Minute Maid Park downtown. It will be state supported and operated by Davico Inc., one of the Astro owners, Jim Crane's subsidiaries. So the city of Houston will provide Houston Police for traffic management, and Houston Health will promote the site. So that testing site right next to Minute Maid will be open on August the 8th. You can always get information about all of the City of Houston testing sites and their locations at houstonemergency.org, houstonemergency.org. Having said that, let me just say, and we'll take questions, there are way too many street parties that are taking place in our city. Too many street parties, they need to stop. There are still too many house parties, and quite frankly, the community spread is spreading by way of these house parties. Backyard parties, barbecues, street parties, Zydeco's on the corner, way too many of those, so please bear in mind. And no mass taking place. And I'm getting calls on Saturdays, Fridays and Saturdays, 10, 11 o'clock at night. So bear in mind, put your mask on. You run the risk now of getting a citation and a $250 ticket. And I think you can best spend those dollars someplace else rather than contributing to, coffers because you don't have a mask on and you are subject to getting a citation for $250. Please don't blame the police. That's just, it is a requirement, and we are holding people to it. Questions for anybody up here?
Hi, Mayor. This is from KTRK. Can you talk about the disconnect that even though hospitalizations are down, that we're actually getting equal, if not more, cases in the community?
And I'm going to call on Dr. Peirce. I would suspect that many of those people are younger, and so, if they contract the virus, they maybe can deal with it a lot better than that older population and people with underlying medical conditions. As Dr. Peirce said, our hospitals, doctors, medical staff, they've learned a great deal on how to treat these patients, and so they're able to treat them and get them out sooner, and so that's been helpful. So the demographics are changing, and so the numbers in the hospitals are looking good. And when I say good, better, every week they're getting better. And I think even today, based on the numbers that I saw, we have about 1,600 people in our hospitals. Well, 2 weeks ago, that number was like 2,400. So the number is now down to 1,600. Now we've got to work very hard to reduce the community spread, okay? Reduce the community spread, because we're still reporting over 1,000 cases positive, every day. The number of deaths are too high. And so we need to work to bring that community spread, those numbers down, hence the citation and the possibility of getting a ticket. But I think that explains it. Dr. Peirce?
Yeah, first, when I came up to speak earlier, Mayor, I dove right into my report. So I, too, want to express my condolences to the Pacheco family. Jerry was a paramedic of ours, and I know his family is feeling the pain. When I say family, I mean his immediate family, but also the fire department family and the paramedics and the EMTs and the firefighters all are feeling that pain. So my condolences to his family and his families. And so to your question, you're right, there's a bit of a conundrum. The good news is that the hospitalizations are coming down. And it's for the reasons that the mayor pointed out. The hospitals are getting better. The medical staff are coming to understand this brand new illness. The technologies, unfortunately, there's no magic bullet cure. There's remdesivir is being used, and it seems to be helpful, and some steroids are being used in new ways that they weren't being used in the beginning, and so technique with an existing drug is improved. But we are also seeing that the number of new hospitalizations is going down. And we had seen that the average age of the people who were infected was coming down. So it had peaked several weeks ago, months ago really, at around 53, and then it got down to about 34. So that's about almost a 20-year decrease in the average. Now, actually, as of Friday, it looks like it may have started to tick back up a little bit again. So that may just be a little bit of statistical wobble. But what my fear is that everybody's seeing good news and taking their foot off the brake. That's my fear. And so we need to not let that happen. Now, if the average age of people testing positive does start to go up again, then unfortunately I think we can fully expect the hospitalization numbers to turn around and start going back up again too. But remember, the hospitalization's a lag. So we may still be reaping the benefits of our good efforts a few weeks ago, but we have to keep it up. So we'll see. We're also looking to see if there are other reasons. We've got the epidemiologists with the city and the county working together to just make sure we're not missing something, because, as you point out, you would think that those numbers would be in parallel, and they're not necessarily in parallel. So we're trying to make sure we're not missing anything. But right now, that's the best we have.
All right. This question is from KRIV. Are all test results, including PCR, rapid antigen, antibody, and molecular tests currently being reported to the state health department? If no, why not? And does this skew the overall scope of the actual situation in our area?
You know, that's a great question. So the answer is that the numbers that we're reporting to you and the ones that are going to the state are the PCR tests only. The other tests that can be done are the antigen tests, and the CDC and the state have not changed yet to want to get those. Now, in our community, that doesn't make a huge difference because there's not a lot of antigen testing that's going on. There is some, and there will be more as time goes on, but at this point, they're still accounting for a very small percentage of the number of tests that are being done. So I don't think we're seeing any skewing of our overall data. Remember, I've always said, don't look at any one number, but look at the way the numbers are changing, the direction they're going in. So so there is a little bit of misinformation there, but I don't think it's impactful for how we're interpreting the data. And then the other tests are the immunoglobulin tests, and I find those to be very inaccurate. And in addition, if you're immunoglobulin positive, that doesn't necessarily mean that you have any immunity. So those are not being requested by the CDC or the state. I don't expect that they will. At some point, they may start wanting the antigen test, but as of yet, they're not asking for those.
Okay. And this one is for you, Dr. Peirce. If not all results from all types of testing are being reflected in the state's COVID-19 numbers, should folks only get tested from those to be more official?
It's another good question. So the issue with the PCR tests are the most accurate tests that we have out there. The problem with them is that the turnaround time of getting your result back, depending on where you go, can be as little as 48 hours or sometimes it's 10 days or more. And that's frustrating, and the state and the feds are working to bring that long time, the 10-day one, we're trying to get away from those labs and make that shorter. And that will happen. The advantage to the antigen tests is that you generally get the answer pretty quickly. The problem is that they are not as sensitive to positives. In other words, if you're early on in your infection, you will likely get a false negative because you've tested too early on. And then they also, and that's actually a fairly large, it can be as much as, the conservative estimates are that they miss 15% of them, and the more liberal estimates say it's as much as 30% of false negatives. That's the problem with the antigen tests. But when they're positive, they're generally pretty accurate, but unfortunately you have to have a fair amount of virus at that point.
Okay. This question is from Univision. What steps are being taken to prevent technical malfunctions with systems keeping track of COVID-19 cases across the state?
Which systems in particular?
They didn't really say.
Yeah, and without knowing exactly which systems you're talking about, and across the state. So that sounds like that's a state data level question, okay. And that may be relating to the fact that over the weekend, the state didn't report deaths on Sunday, I believe it was, because they're shifting over. And this goes to what we talked about, I believe this goes to what we talked about last week, and they're changing the part of the reporting for the deaths. It used to be that you needed to not only have the death certificate, have COVID on it, but in addition, you needed to have a positive test result. And so they're no longer requiring the positive test result. So there's, neither of those two ways of counting is 100% totally accurate. You're going to get a little bit of undercounting if you look for there to be a positive test result, because sometimes people can test false negative, and other times people have clearly got the disease from a clinical standpoint, but they never got tested, so they wouldn't be counted. This way you may get some overcounting, and then if you go by the clinical diagnosis, perhaps somebody died of something else and the clinician didn't get a test done, and so they thought it was COVID, and if you knew 100% of the information for it. So I don't see a huge, there's going to be a little bit of inaccuracy both ways, but again, what have I been saying? Don't worry about any particular number. Just look to see which way the trends are going. That's what you need to pay attention to.
Okay. And this question is from Houston Press. Were you aware that rapid results COVID-19 antigen test data hasn't been included in statewide COVID-19 test reports? Do the Houston Health Department and Harris County Public Health receive data from these rapid result tests, and is there any plan to include those results in city case totals going forward?
Okay, so this is basically the same question that I asked earlier. Yes, we've known that they've been being performed. Again, it's a small percentage, and it's not my decision. It's not our local decision. That'll be a CDC and state decision if they start counting them. It wouldn't surprise me in the least if at some point that they do. I think that their concern is the accuracy of the tests. But we'll have to wait and see what they decide. And we will follow the national standard.
Okay. And this last question is from Houston Press Media. Last week you talked about a decrease in the amount of people going to get tested. Can you provide a little more detail, numbers on last week or two compared to a month ago? And do you have any thoughts on why this may be happening?
I think the team is trying to pull up the slide that we showed last week. We actually had a graph that showed the decrease in the number of folks going to the testing sites. And it's been fairly remarkable, the number of the drop-off. We were maxing out at our 2 stadium sites at 650 people per day each for quite some time. And it's dropped down to less than half of that. And I see that they're trying to find it. But it's dropped off less than half. And, you know, your question is a good one. The problem is I don't know how to get the answers to why, because, you know, how do you find the person who was going to go but then decided not to ask them why they didn't go? We can talk to the people who came and ask them why. They'll tell us, but that doesn't tell us why somebody chose not to. So it's conjecture. So my fear, and this is complete conjecture on my part, but my fear is that people are hearing the good news coming out of the hospitals and thinking that, oh, we don't need to worry about it anymore. And that's what has me concerned, because that is not what that message should be. We still have way too many people currently in the hospital, and even our positivity numbers, while they're improved, and that's today's good news, is the positivity numbers are down, but they're down to 17.6%. We need to have those down below 5%. So we're still way too high. And if, you know, we've used the analogy of a school bus to remind people we want to get the schools open again, but the school bus is still going way too fast. This is not the time to take our foot off the brake, even when we've got some good news. And thank goodness we finally got some good news, but it doesn't mean it's time to take our foot off the brake.
Hi, Mayor. I want to ask Chief Acevedo in English and Spanish about how HPD officer will enforce the new order starting today.
Sí, es importante que la comunidad sepa que el gobernador Abbott ha pedido que las autoridades en el estado municipales empiecen a dar multas por no ponerse la máscara, y el alcalde anunció hoy que inmediatamente los oficiales del departamento de policía, si lo encuentran sin máscara, le van a dar una advertencia, y si no obedecen la orden, van a tener una multa que le van a dar de $250. Así, ¿para qué va a perder $250 en esta época con tantos problemas económicos? Póngase la máscara, no se busque el problema. El fin del día vamos a mantener la seguridad, la salud pública por usar esta máscara. Si yo la uso, el alcalde la usa, el jefe de los bomberos, el médico, todos los usamos. Todos los demás tienen que usarlo, especialmente la comunidad hispana, que es la que está más afectada con los afroamericanos por este virus.
Well, you could say that in English also, if you want. Yeah.
What he said is that the police will be out there. We're not responding to 911 complaints, but we'll be out there and we are patrolling, and we encounter people who don't have their masks on. We will give them the initial warning. If they still don't comply, then they'll get the citation or the ticket at $250. Now, I didn't quite understand when he did that hand gesture like that. I really did like that, you know. So, yeah, that was, you know, don't waste $250, put your mask on and keep the money in your pocket. In essence, that's what he said. I mean, he just was a lot more expressive than I was.
Mayor, also, I want to ask Chief Peña his report in Spanish pretty quick, please.
Seguro que sí. Mire, lo que quiero reportar hoy es que tristemente hemos perdido un segundo bombero al coronavirus. El bombero Jerry Pacheco es un veterano de 17 años, ha estado en el departamento de 17 años y tristemente murió esta mañana, pasaditas a las 5 de la mañana, de complicaciones del coronavirus. Jerry también tiene un hijo que es bombero aquí con el Departamento de Bomberos de Houston, Justin, y tiene otro hijo también, Jesse, y su esposa, Jeanette Rodríguez. Y les mandamos, como decimos, nuestro más sentido pésame a ellos. Nosotros hemos tenido en el Departamento de Bomberos, ahorita tenemos 130 personas en cuarentena, bomberos en cuarentena. Hemos tenido 31 bomberos que son positivos para el coronavirus ahorita actualmente. Y en total hemos tenido más de 218 bomberos que han estado positivos por el coronavirus. Lo que queremos decir a la comunidad es que hay 3 cosas que podemos hacer para ayudarnos a combatir esto. Usar las mascarillas, mantener la distancia física y un higiene apropiado. Y eso nos va a ayudar a mantener este virus para que no crezca tan rápidamente. También lo que queremos decir a la comunidad hispana y a toda la comunidad de la ciudad de Houston es que no teman llamar al 911 si necesitan ayuda, si es una emergencia médica o una emergencia de seguridad. Lo que estamos viendo es que las personas parece ser que están esperando mucho tiempo para llamar al 911 si necesitan atención médica. Y hemos visto un incremento de personas que mueren en casa. Que no teman ir al hospital por temor que ahí esté el virus. Están más seguros yendo al hospital que tener un problema médico en su casa, ¿sí? Y que no se esperen mucho. Si tienen síntomas del coronavirus, si tienen una fiebre, si tienen que les duela el cuerpo, llamen a su doctor. Pero si es una emergencia, que no puedan respirar, que tengan problemas al corazón, otra emergencia crítica, llamen al 911 inmediatamente. La información que nosotros tomamos es solamente para el tratamiento del paciente y pasar esa información al hospital. ¿Sí?
Dr. Pierce, first, I want to say that President Trump says the media never congratulates him and his team during the press briefing, so congratulations to the mayor and your team for the numbers showing that in this phase we are having results. Having said that, because I don't want us to be a very bad media and press, having said that, I want to ask this question, 1A, 1B, and 1C, to Dr. Pierce. It's one question. 1A, has any form of phenotypic and genotypic studies been done to try to see if some of the briefings that we get from WHO and the announcements that South America, the Americas are really epicenter of this COVID-19 presently, is actually related to what we see in the Latino community and Hispanic community in Houston? And B, since children are also coming up with COVID-19, and we are in the breastfeeding week, what would you say to nursing women, pregnant women, about their fears related to the encouragement for them to do the 6 months breastfeeding and the possibility, if there is any, of them transmitting COVID to their newborn babies through breast milk? Thank you.
Okay, so I got 2 questions out of that, not 3, but so I think you asked about the genotype and phenotype and how it relates to the Hispanic community, right? So there's nothing to suggest that people of Latin descent are in any way genetically predisposed to being infected with the virus. It appears that this is really more a function of the social determinants of health and poverty. So we know that in the Latin community, especially with the Spanish-only speaking Latin community, that there are a lot of people who work minimum wage jobs, they work multiple jobs, they live in multiple generational housing. These are all social determinants of health. They don't have medical homes often. They often don't have health insurance. And so they're, whether you're Latin, African-American, Asian, Caucasian, or whatever, if you are dealing with poverty and all the implications of that, you have all the risk factors that are going to put you in a bad situation should you become infected. So it's more along the lines of poverty than it is anything genetic. And to your second question about babies that are born to moms who, I'm assuming your question is moms who have COVID disease or are infected. At this point, right, and you asked about the breast milk. So at this point, it doesn't appear that there's very much. I think there have been only a handful of cases where it appears that maybe there is what's called vertical transmission. That means infection from mom to baby. It appears that doesn't happen before the child is born. It may be happening during the birthing process that the child becomes infected. And I will pass on the question about breast milk because I don't actually know. But I do know that the obstetricians and gynecologists and the breastfeeding experts that help newborn moms, they do know, and they are being advised on what to do. I'm sorry, I don't happen to know that piece of information. So.
Yeah, the C part of the question was the deaths today were all Hispanic community people. So you see that would create anxiety, fear, and related issues. That's why I was going to ask you to address that community and take care of that fear aspect with what we are getting today of all the deaths in that community. Thank you.
Thank you also very much, and we'll keep you informed. Thank you.
All right, Mayor Turner there with his team giving us a lengthy update today about what's happening in Houston with COVID-19, and I think that is you see there some of the numbers that the mayor talked about a little while ago, 6 new deaths and more than 1,100 new cases. But the big story to come out of this press conference here was the fact that Houston police officers will start citing people who do not wear a mask in public if they're around other people. Up until now, it's been a friendly conversation with an officer if he or she sees that in public, but now the officer will approach somebody, ask them to put one on, and if they don't, it could be a $250 ticket. So the mayor says he's done messing around with folks that don't follow the mask order that's statewide, and you know the rules. If you're around other people out in public, you need to have one and put it on and wear it, and the mayor says too many people are not doing that, and the positivity rate here in Houston is still way too high, and that's why the mayor is taking this step. He sees. We'll see how many citations actually get issued, but the mayor is certainly threatening that in today's press conference. We'll take a quick break here. We're back with the 411 in just a couple of minutes.
AC getting up there in age? Mission AC will give you up to $2,000 to buy back your old AC unit. Call now and save $2,000 on your new system backed by a 12-year parts warranty.
Improve your condition with Mission.
I'm Craig Biggio for Atlas Foundation Repair. If you have doors or windows that